All right, my name is Dr. Theresa O'Keefe, and I would really like to thank you all for not only inviting me to come, allowing me to come speak, but what you are covering. My background is I have a PhD in molecular immunology from Tufts, and from there I went to the Laboratory of Molecular Biology in Cambridge, and the MRC LMB is famous for its 13 Nobel laureates, including Watson and Crick for DNA and Cesar Milstein for monoclonal antibodies. I was very privileged to work with Cesar while I was there. For the last 15 years, I have worked in drug development for a number of companies, including Millennium and Pfizer. My specialty is protein drugs, specifically protein drugs for autoimmunity and cancer. I was involved with a team that produced Campath, which was the first antibody drug, and I'm also the sole inventor of Vidolizumab, which should be a revolutionary drug for Crohn's disease, which we hope will come out in the next year or two. Now, the Commission is talking about issues and how they impact human health, and I'm delighted you're doing this, because we do impact human health by the things we put in our environment. And me, with my background being interested in cancer, really understand that we've had a revolution in the treatment of cancer over the last 15 years. Absolutely amazing. But with all the things we do, the number one best treatment for cancer is prevention. Early detection is important and treatment's important, but the better thing is to prevent the cancer. And the best way to do that is to reduce our exposure to carcinogens in the environment. The previous experts have been talking about all types of drugs, take-backs, whatever, but where do we start? And I'm reminded of an Aesop's fable that all the animals were standing around boasting at how many offspring they had. And then finally the lion spoke up and says, I have one offspring, but it's a lion. So I'm going to talk about the lions, and I'm specifically going to use one lion as an example. If I could have the first slide. Now, cyclophosphamide is a phenomenal drug. It is first-line treatment for a wide range. What I'm going to do is, because we're writing late, I'm going to go through this fast, and so please ask me to come and talk to you individually to cover some of the information that we don't get to tonight. But it is an incredible drug. It is in our arsenal, and it has been fundamental in helping us to have 11 million cancer survivors. Next slide. There are a lot of protocols that use cyclophosphamide. Cyclophosphamide was developed in the 50s, but it frequently now is used in combination. And some of those combinations will have up to 9 different drugs. But I imagine most of the people here know somebody, themselves, a family member, a neighbor, who has been on cyclophosphamide through one of these protocols. It is used up to 50 mg per kg, and that's kgs is by body weight of the person. This means an adult male could receive 4 grams or more. Now, they always adjust the dose because of the protocol it's on, for the patient's response, both positive and negative. Next slide. Now, cyclophosphamide must be used with care. Its method of action is to attack double and stranded DNA, chromosomal DNA. It can cause breaks, it can cause translocations. And it is not specific for cancer. It will attack any fast-growing cell, both within the patient and within somebody else. Therapeutic dose is high because you must overwhelm the cancer. You just hope that you overwhelm the cancer before you overwhelm the patient. And there's a lot of consequences of it, of the negative side effects of this. Next one. Cyclophosphamide is a known carcinogen. So well known that when NIH first came out with an annual review of carcinogens in 1980, it was there. It is no longer produced in the US. There is extensive evidence of caregivers who work with patients having not only cyclophosphamide in their urine, but mutations to the white blood cells and the cells that slough off in their urine from the bladder, mutations from having accidentally been contaminated with cyclophosphamide. Next slide. Cyclophosphamide causes severe birth defects. I'm very sorry about the photographs. They are unpleasant. There's a problem anywhere in the world. Unfortunately, too many women have started treatment for chemo and then discover they're pregnant, and they have to make some very difficult choices. A lot of them will actually terminate the pregnancy or miscarry, but there have been some that the baby has actually survived, and also a lot of times you lose both the mother and the baby. Cyclophosphamide has kind of a classic profile. They have all types of abnormalities in their face, their head, the vascular system, their gut. They have abnormal or missing thumbs. They have abnormal or missing fourth and fifth toes. Could I have the next one? And cyclophosphamide, the reason I'm using this as one of the lions is because as much as 25% of the original dose of cyclophosphamide is excreted as cyclophosphamide. This means a patient who's had 4 grams, in the next 24 hours, their urine will have a gram of cyclophosphamide. That is enough to kill a 2-year-old child outright. The American Cancer Society, I mean, this is well known. That was known when the drug was approved. It is actually in the drug insert. I'm not sure, drug inserts are those heavily folded pieces of paper that come with all your pharmaceuticals, which nobody ever reads. In fact, you should. You can go to the National Institute Laboratory of Medicine and see all the drug inserts for every drug in the US. When they had cyclophosphamide came out, they listed all these dangers because they knew that, and that was in the 50s. The American Cancer Society has jumped on the bandwagon of saying, you must be careful. Your toilet is a hazardous to children and pets. Even today, with all the very strict cleaning that hospitals do, they know that the bathroom toilets of the patient's toilets are heavily contaminated with cyclophosphamide. If you're in a house and you have a child that climbs in there, because you can absorb it through your skin, and puts their mouth on the floor, what is the risk to that child? And one of the worst characteristics from an environmental standpoint of cyclophosphamide is greater than 98% of it passes through all existing wastewater technology. Greater than 98% of it passes through all existing drinking water purification. That means municipal, things like Providence or Newport. Septic systems don't have a chance.